Now, the expected budget cuts affected by National Treasury in the midterm budget policy statement have rocked the public health sector. A number of senior doctors in Western Cape hospitals have come forward anonymously to share the dire situation in hospitals, stating that positions are not being filled timeously, among other things. The South African Medical Association trade union has pleaded with the Department of Health to employ hundreds of critical medical staff who are sitting at home. And joining us now with more insight is Deputy President of SAMATU, Dr. Nkateko Mnisi. Thank you so much for your time, Doctor. Now, Treasury is under a lot of pressure to cut spending across the board, but is there too much restriction on the healthcare budget, considering how important it is?
Good evening, Zinati and all the listeners here today, and thank you yet again for having us. The budget cut indeed has really affected the healthcare sector, not only the hospitals in the Western Cape as depicted by doctors who contacted you, but what they depict is what we see in all the hospitals, or should I say majority of public hospitals throughout the country. The reality is this: health is not something that is of privilege. It's a basic human right. Yeah. And when budget cuts affect, how do I put it, the bread and butter of our country, the bread and butter of life, it's something that us as the Medical Association trade union cannot keep quiet about. Especially when we find ourselves in an instance where there are so many doctors sitting currently at home. In fact, healthcare workers, not only doctors, sitting at home, unemployed and wanting to serve the community. And on the other hand, in our hospitals, we have high vacancy rates, with hospitals even reaching 50 to 60% across the country in terms of vacancy rates. In our database currently, we can even account for approximately 825 doctors that have identified as unemployed post-community service. And because what happens in IT is after you complete medical school, you have 3 years statutory obligations to the government, 2 years of internship and 1 year of community service. After then, you are then seen as an independent practitioner or fully qualified doctor. And those are now the doctors that are sitting at home and saying, here we are. We want to serve our country. We are right here to serve. Please give us an opportunity. And at the end of the day, we know that in South Africa, majority of our population depends solely on the public healthcare system. And we need for it to be at the best standard it can be, because quality healthcare is something that we all deserve, irrespective of where you are in the country.
Let's actually talk about that, those healthcare workers that are sitting at home. I understand that there is a freeze on hiring new employees. What options then do those, for example, those newly qualified doctors have right now?
First, I'd like to say I urge the government to really focus on healthcare and hiring these doctors. The reality is this: many public entities have been bailed out in times of dire need, irrespective of financial implications. I mean, just to name a few, we can speak about Eskom, we can speak about SAA, I can go on and on, Transnet, so much more. The healthcare system is something of that much more importance as well. The reality is, as a country, we cannot flourish economically without a population that is at its optimal health, especially when you look at those that are in their productive years. And these doctors at home are part of them. They do have many other options, but a lot of them have seen how the situation is in the public sector and would like to continue serving there. Some of them have had the opportunity to work in rural, deep rural areas such as in Limpopo and Mpumalanga, just to name a few, and would see that their services are needed there and they are willing to work there. What is happening is they do have an option to go into the private sector in whatever way they want. They can move out of clinical services, but we're also seeing a trend where many recruiters from other countries overseas, particularly first world countries, are looking to poach, or should I say, welcome these doctors. Because the reality is the standard of training and the quality of doctor that comes from South Africa is one of very high stature and is one that is wanted throughout the world. So when we find ourselves in this dire situation where we ourselves also want the best of the best to be in our healthcare system, and we're not absorbing them. then many others who see an opportunity also see an opportunity to take the hands in which we also need.
Yeah, Nkateko, you make really, really interesting points and very important points that, I mean, we have seen the government, as much as there's no money, but they have been bailing out other important organs of the economy. Why is healthcare being left behind? And of course, now we could end up in a situation where we are losing critical skills and expertise to other countries when we actually do need, all this talent in the healthcare sector. And just talking about the talent in the healthcare sector and just the general situation of that, because of course we also have the NHI right now that government is working to implement. Could these headwinds that we are currently experiencing in the healthcare sector have an impact on the implementation of the NHI and also its reception by the population?
Look, NHI is the vehicle which can bring about universal healthcare coverage here in South Africa. And it's something that we all know that the bill has been passed in Parliament. So in order for NHI to be effective, we also need to, number one, work on the infrastructure, which I think the government may be working on currently.
Yeah.
But also we need to also optimize the human resources. If we don't have enough human resources, how do we ensure that this system is sustainable and works adequately and well?
Yeah.
So one of the first steps that needs to happen in our road to NHI or universal health coverage, we need to ensure that we have human resources that are well equipped in all our hospitals from every single corner, not just the urban areas, but also the rural and the peri-urban areas of South Africa as we look forward. Because as I'm saying, we want a system which doesn't create a backlog in particular areas that are more urban, or should I say, the tertiary and the secondary institution or regional institutions. We want even those at primary healthcare level to be equipped. And I know for a fact, I've spoken to so many of these doctors, and even many of them can attest, they are willing to be placed anywhere. They are here to serve our country and our population.
Yeah. And just quickly, as we wrap up the conversation, we have less than a minute. What will the healthcare ecosystem be looking for in the upcoming budget speech?
We're looking for a lot. But as I said, man, health is something that shouldn't be a privilege. It is a basic human right. And in the budget speech, we hope that the relevant funds will be released and allocated to the absorption of post-community service doctors, as well as other integral healthcare professionals in the allied sector and in the nursing sector who are needed to optimize our healthcare system as it currently is. So as a SAMATU, we're here to unite doctors and represent all doctors throughout the country. But what we also want, by empowering them, is to allow for quality health care to be given to every single member.
Oh, Nkateko, I think you just were muted there for a bit. But we did get the gist of your answer. Thank you so much for your time and for your insights. And we're really, really hoping for the budget speech to put in more money into healthcare, because it really is something that is not a privilege. It is a necessity. Thank you so much for your time. That was Deputy President of the South African Medical Association Trade Union, Nkateko Mnisi.